Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we're going to talk about something which, you hear about it in many different, news sources and otherwise. You hear about it relative to violence, gun violence, homeless, people who have mental health issues or apparent mental health issues. So I just thought we'd bring on two extraordinary guests who are experts that are dealing with a program in our College of Nursing here at Nova Southeastern University which deals with behavioral health. So let me first introduce to you Dr. Barbara Barrett. Dr. Barrett is not only a PhD, but she's a DNP as well, which means Doctor Nurse Practitioner.
Correct.
And an ARNP, Advanced Registered Nurse Practitioner, and you're board certified. So, and you're the Associate Dean of the for Academic Affairs at our College of Nursing here at NSU. Welcome.
Thank you.
A lot of words. And here is the boss. Here she is. That's Dean Marcy, or Marcella Rutherford, otherwise known as Marcy. And she also is Dr. Marcy Rutherford. And she also has an MBA and Master's in Nursing. And she's our Dean of the College of Nursing. Welcome, Marcy.
Thank you, Dr. Lippman.
Good to have you.
Thank you.
These are very important people in the field of nursing. They're what I would call the pioneers of the evolution of nursing in not only the state of Florida, but nationally. So I think you're going to have a good time listening to what they have to say. Dr. Rutherford, otherwise known as Marcy, tell us why and how our College of Nursing is involved with, in quotes, mental health, but we're calling it behavioral health. Go ahead.
The students at Nova Southeastern University are still receiving the full course complement to prepare them to take care of patients with behavioral health issues. In addition to that, we have psychosocial pieces embedded in the other areas that the students receive their education. Not all nursing programs across the country have maintained that individual course for mental health. As things changed in the 90s and the beds for mental health patients were reduced, graduating nurses were no longer tending to go into mental health. And so therefore, the licensure board exam did less questioning and schools had less content in their program. But Nova Southeastern is committed to making sure that the nurses that we graduate at the bachelor's level are prepared to take care of mental health patients. But in addition, they are prepared to identify in those patients that have medical conditions those co-occurring episodes of behavioral health. As 1 in 4 Americans today have an underlying behavioral health issue, that means that the medical patients they're taking care of so too have behavioral health issues that could impact and often do impact their ability to return to health. So the students, we're very committed to make sure that the nurses that graduated from Nova feel confident in taking care of patients with behavioral health issues.
Well, the reason why I wanted to get to this subject area is because we're getting a lot of folks that, we get a lot of program needs and content comes from the viewers that ask questions. And, not to get into the world of politics or community affairs, the reality is that every day somewhere, whether it's on television or in the newspapers or something, someone talks about the mental health component of an event. Dr. Barrett, talk to me about, in quotes, behavioral health.
Well, let me just add, and I will get to that, let me just add also that our nurse practitioner program, our family nurse practitioner program, is one of the few nurse practitioner programs that also includes the behavioral health education component, because not all programs, local and nationally, include behavioral health. So that was important for us to make sure that we keep that piece for our FNP students. Overall, behavioral health, mental health, there's a transitioning in the language. Everyone, or maybe not a lot of people know, but mental health has carried with it a stigma for many years. And in looking at that stigma, it has been difficult for these individuals to get the health care that they need, and even to be included across the board. So what has happened over the years now is a shift to change that language from mental health to a more inclusive language, behavioral health, because we all exhibit different types of behaviors. Some of us are able to control our behaviors in manners where others may not be. So the shift with the language hopefully will help to minimize some of the stigma that mental health has carried with it. And over the last few years, or within this last decade, there's been a lot of legislation that is helping to, or is trying to help to remove some of that stigma, to ensure that there's parity with medical and behavioral mental health in terms of benefits, healthcare benefits. So hopefully that, we will all be able to be a little bit more inclusive of these individuals that have these challenges.
And the term also umbrellas substance abuse
Right.
into behavioral health, encompasses not mental health but also substance abuse issues.
Well, that's a very important point
Very.
because, again, one of the continuing headlines that's been continuing in our media and print media as well as television and radio has been the issue of substance abuse that goes all the way back to the 50s. Every 10 years there seems to be a revival of interest because something has happened. And I got to believe that nurse professionals, who I know as the sentinels inside of the healthcare system, just where you both are sitting, within the last few weeks we did shows with an oncologist and also a cardiovascular surgeon. And in both of those shows, the issue of depression came up, the issue of the use of certain opioids came up, and the reduction of need for certain types of pain control issues came up. So I got to believe that in producing nurse professionals, that you are putting into the behavioral science portion of it some, I guess you could say, voices for the reiteration of these things that are plaguing our society today. Is that true, Barbara?
And that is so. And there is a lot of evidence outside that shows that individuals that have chronic disease processes tend to have behavioral or mental health challenges just because of the chronicity of their disease challenges. For instance, cardiovascular disease. It can be a chronic type of disease, and it could render someone to have a mood impairment, depression, just because of the length of that disease process and the toll that disease process can have on the individual. So yes, it is very important for oncologists, for cardiologists, for pulmonologists to all look into how behavioral challenges could impact their clients because of the chronicity of their diseases.
Let me just, and I look at it from my own retrospective time in public service and healthcare. I remember very clearly, of course, during the 60s primarily, and the early 70s, there was the Big D project. It was deinstitutionalization. Do away with which these places were pretty bad. Some of these, they were bad. They were warehouses.
Right.
And I don't mean to denigrate the people who worked there, but that's what they were. And the Big D project was to get the mentally ill, many of which were improperly diagnosed. Some of them were hypothyroid, some of them had many different things that which led to
Epilepsy.
unusual behavior.
Right.
And so the Big D project came along, and which means they deinstitutionalized and took people out of mental health institutions.
Right.
and put them into the community, but the community didn't absorb them. So now you had a whole society of, and right after the Vietnam crisis and whatever, you had a mixture of people that ended up on the streets. Now, of course, there's been some great advocacy, great focus on that, but yet the mental health element of it has not really been brought to the open end of our thinking. I mean, we hear it because somebody says, well, a crazy person went into a school and killed 19 kids or 30, whatever.
Right.
That's where we hear it. But we know, I think you know, I don't want to say we, I'll let you, the professionals, talk about the, like you say, the incidence of a nurse professional working in a healthcare establishment, dominantly hospitals, and often in medical offices, come across situations. And that's the training that we're giving in our programs.
That's correct. And with this groundswell, which you're talking about, of interest that seems to appear cyclically in our society, we've got a different issue today in that we really don't have the workforce with the parity and the reimbursements being there for most individuals with insurance to have care, behavioral health care under their health care, which is important, but you really don't have, we're struggling with the workforce and the facilities to take care of these patients. So when they approach in the hospital or they approach in the primary care, we don't just focus on their medical issues or funnel them into wherever we can find, which is difficult to find placements for patients with identified behavioral health issues, including pediatrics. And in the rural environment, it's even worse. So one of the things that I feel strongly, and we work on at NSU, is that the only workforce that has enough individuals, professionals in it, that could really make a dent in this issue of reaching out and doing early identification and early treatment interventions and getting patients where they need to go is really the nursing workforce. With 3 million nurses across the country in every avenue of treatment from acute to primary care, the nurse, with the proper education and the support and the resources, could and can be the first line individual that could make a difference if they focus on making sure that they know behavioral health is part of health, as Dr. Satcher always said, and making sure that it's in the forefront of that nurse professional who's taking care of the patient and the family members.
You know, I'm thinking back to the program we did with this cardiovascular interventional surgeon, that was specialist that was here. And he was talking about the fact that many people that he sees, all right, and cares for, he's prideful, and as he said, he was blessed to have the kind of nursing care in the institution that he's in, because, you know, after he's finished with his work, the other 95% or 90% or 80%, you can pick it whatever you want, is dealt with by the nurse professional.
And that is correct, because nurses historically and currently have been trained holistically and trained and educated holistically, in that they are educated on caring for the whole individual, not just the physical disease symptoms, but also the social and mental health aspects of an individual. So we're educating nurses from the entry level in that manner, and then as they continue on with their education as nurse practitioners, as other nurse professionals, they continue this holistic type education, so that when they are out there in the professional world, they are able to look at the patient as a whole and not as the disease that presents or the symptom that presents to them. So it's one of the key pieces, I believe, of nursing education.
Dean Rutherford was talking before about drug abuse, or really you can put out any kind of addictive alcohol or drug abuse, or really both. It is often the nurse professional that acquires not only the basic information, but the I guess you could say the transitional information that occurs while that patient is in an environment where the nurse professional is viewing them on a day-to-day basis. New wonderful healthcare modalities. The nurse professional still is, like I said, is the sentinel.
They're the coordinators of care. They're the real care managers that follows them across their whole practice environment. So when you're talking about behavioral health, or you're talking about affordable care organizations in the outpatient area with the Affordable Care Act, where you're having a complement to keep the quality of care high and the cost low, it's important to be able to identify, and people are starting to realize the holistic view of the patient, because if you've got a patient with a cardiac or cancer, you want to identify the depressions, the anxieties, the underlying behavioral health, and the early signs of drug addiction or abuse of alcohol, so that you can keep them healthier. In addition, those nurses in the acute line of fire, wanting them to feel safe and having the education to know how to take care of an acute patient exhibiting symptoms. And then hopefully with the evolution of our system, we'll find places to refer these patients to, because right now we have a serious issue with patients stuck in the ER and having no beds, especially pediatric and adolescents, but no beds to transfer the acute. So it's talking about how do we take care of those patients with those acute episodes, but also how do we shore up our healthcare team to identify earlier and prevent that person from being in an ER with an acute episode.
Well, again, I referred to one of our viewers' comments about, I was up north. I was in New York and lived in Long Island and everything. I don't remember, the viewer said, I don't remember people getting into road rage, I mean, the traffic was terrible, but I mean, all of a sudden you see people getting out of their cars and hitting each other with axe handles or whatever, or with brooms. I mean, but that's part of what we're seeing today.
And it's part of that mental / behavioral health piece that identifies that thinking of the world we live in today and all of the stresses that come along with life today, which is much different than the stressors from years ago. Many people are often not able to cope with some of those stressors, and that's the key between mental behavioral health and unhealthiness, if for lack of a better term, because if you're able to cope with those stressors, then those behavioral symptoms like road rage and things like that, you're able to curb on the inside. So that's really what is like a signal to society that, wait a second, their behavior is going on out there and they're coming from somewhere. Where are they coming from? We need to be honing in when we have these individuals around, when they're going into primary care, when they're going into the OBGYN offices. We have to start educating all of these professionals that there are some signs and symptoms that we need to be looking out for, that maybe someone is going through some acute stressors that they may need some assistance with. I think we as a community have to maybe try to hone in a little better on our assessments, especially the professionals, on our assessment skills, so that we're able to identify, wait a second, maybe there is a need here that needs to be addressed.
It's interesting. I was just thinking about, we've had a couple of shows about obesity. And obviously there are various techniques, surgical techniques, based upon, I guess you could say, chronic issues, body mass index and things like that. Right. Not everybody goes in for surgery. I mean, but there are other people that go in for surgical techniques to enable them to cope with their will to continue to eat food. Right. But that's where the psychological intervention comes. In other words, it isn't just the surgical involvement.
That's right.
It's the point from the time that they get out of the OR to the point where a year from now they're going to be where they hope they're going to be. Am I correct?
That's correct. And a big component of many of those obesity type programs is the psychosocial piece. How can this impact a person's mood, and what effect would this have on them? Will they be able to mentally, emotionally follow through with this process? That is a big piece for many of these obesity surgeries and other obesity intervention aspects.
Well, again, we're very proud of our program, our nursing program, but I really think, and I pledge my support, obviously, but I really commend you both as the assistant dean and as the dean of the College of Nursing here at NSU for keeping that on the forefront, because I do believe that the people who are asking questions don't really understand who are the signal viewers and the real signal viewers. Because people who have, and tell me if I'm right or wrong, people who have some of these mental health issues, behavioral issues, or stressors, many of them cry out in one way or another.
Yes.
Is that correct?
That's correct. And there's many simple tools that have been developed that take a matter of a few minutes that you can use as well as a provider to really do a first line assessment of, is there really something here that we need to look deeper into. But it's taking the time to talk to the patient. Oftentimes it's just taking that social history, going beyond the symptoms they're exhibiting, whatever there is that brought them to the office, and then you get signals. Because of taking care of patients, you see those indicators, and then just taking it that step further. And the nurse professional really is that person at that care coordination, care management piece, because they're very aware that once the physician or the care provider comes in, nurse practitioner comes in and makes the diagnosis, that's just the first step. Then the issue of assessing the ability of the patient and the family to carry on and to do. And those early indicators make all the difference of how do you plan and help that patient return to health.
Barbara, I don't know whether you want to add to this, but one of the things that I was discussing recently with individual large practice was that a lot of people, we use the word nurse generically, because a lot of people, and they're wonderful MAs, medical assistants that are inside the office, but they're wearing, whites or scrubs or whatever, and everybody says, oh, the nurse took care of me, or the nurse asked this question, but they're not nurse professionals. But and I'm not demeaning or denigrating any of them. I think they do wonderful work, but I really think that by us continuing this holistic view and providing for knowledge, because the greatest problem we have in society is not ignorance, it's non-knowledge. It's the use of knowledge. If we use this knowledge as taught to our nursing students, I think we could curb a good deal of the so-called mental health problem.
Yes, I think so. And back to what you talked about, everybody being identified as a nurse, it is a challenge for our profession, and it's up to nursing students and nurses at large to just educate the public at large so that they're better able to understand. But yes, nurses, in educating students, educating the public about psychosocial, behavioral health, mental health, it brings it to the forefront. And I think the only way that we can address any of these issues is to first start to have conversations, and so that these conversations can bring the topic to the forefront, much like how medical health has been brought to the forefront.
Well, believe it or not, we had a nice conversation here, but we're down to the last 20 seconds of this show. So I'm going to say thank you both very much. Thank you, Dean Marcy Rutherford, Dean of the College of Nursing at Nova Southeastern University, and thank you, Associate Dean for Academic Affairs, Barbara Barrett, Dr. Barbara Barrett, and of course Dr. Marcy Rutherford, for both being here. It's a very difficult subject area, and we could probably do another 3 shows just on this, but the people ask questions, and so the news media has heightened so much of this mental health activity, and I thought it would be a good opportunity to let people know that we're teaching our nurse professionals here with a component called mental health and behavioral health. Thank you both for being here. Folks, I hope we answered some of your questions. If you have any other questions, there's an email address here and a contact number. Be sure to get in touch with us. We'll try to get you the answers. And remember, this show is your show, so if you have any other issues that you want to know about, just give us a call, contact us, let us know. This show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, remember, take good care of yourself. See you.